temperature-controlled RF system is indicated for use in dermatological and general surgical procedures for electrocoagulation and hemostasis. Prior to use, there are a few pre-procedure recommendations. They are as follows. 1. Prior to operating electrosurgical generator, please refer to and follow the instructions for use. In addition, please review the user manual shipped with your Thermi device. 2. Review patient history. Suggested inclusions are current negative pap smear, pelvic exam within 1 year, negative for pregnancy, negative for infection/wounds, including but not limited to herpes simplex virus, lesions or abrasions, UTI or yeast infections, no metal IUD in place. 3. Confirm informed consent is signed. Please note the sample informed consent is distributed to Thermi customers in a PDF-only format. It is non-editable and designed as a template that can be customized according to the customer's needs. 4. Ensure hair on external treatment area has been removed prior to treatment. Shaving should be completed 1 day prior to treatment. Waxing or laser hair removal should be completed 5 to 7 days prior to treatment. 5. Have patient empty bladder prior to positioning for treatment. 6. Ensure you have all supplies needed, including clear ultrasonic water-based gel, cleansing agent, gauze, spatula for gel application, and a disposable ThermiVa electrode. 7. Position patient in a lithotomy position. Ensure that the position allows you to apply the electrode to the surface of the skin with firm, even pressure. 8. Take photos of treatment area based on office protocol. Console setup. 1. Carefully unpack and inspect all components shipped with the ThermiRF Plus temperature-controlled RF system. If any parts are missing or damaged, contact your Thermi authorized representative. 2. Position the console in a convenient location so that the procedure screen is visible and within reach of the operator. 3. Attach the generator power cord into the rear panel power cord connector, then plug the cord into the surge protector on the back of the cart, and from there plug directly into a grounded 120-volt AC power source. If you do not have a cart, plug directly into a grounded 120-volt AC power source. 4. Connect the foot switch into back panel foot switch connector and place within foot reach of the operator. Note: foot switch use is optional. The RF button on the front panel performs the same function as the foot switch. 5. Connect the disposable grounding pad cord to the black neutral electrode connection port at the bottom left of the front panel. Assure the plug is fully seated into the connection port. Place grounding pad on the patient close to the area being treated, avoiding bony prominences, and ensure full contact with the skin, and apply as directed in the instructions for use for the grounding pad. 6. Select the ThermiVa electrode. 7. With the Thermi logo facing up, connect the ThermiVa electrode to the port located to the right of the grounding pad. 8. Turn the ThermiRF Plus temperature-controlled RF system on using the rocker switch on the rear panel. The generator performs a system self-test to determine if it is performing properly. 9. During the self-test, the generator will emit a long beep and all 3 front panel LEDs will illuminate, indicating that the self-test is complete and the generator is now ready for use. Once the electrode is connected, the ThermiVa option will be automatically highlighted. Confirm by pressing the button below the check mark. A blue light will begin flashing in the upper right corner of the generator. Using the soft keys to the right, increase the set temperature to the desired starting temperature. Recommended procedure guidelines and techniques. Vaginal canal. 1. Apply a moderate amount of warmed water-based ultrasonic gel to electrode. 2. With energy off, introduce the ThermiVa RF electrode into the vaginal canal until resistance is met to measure depth of vagina. 3. Note maximum length of vaginal canal, then withdraw the electrode 2 to 3 centimeters from cervix. This will be your maximum treatment depth. 4. Select desired set temperature. Recommended starting set temperature at 37 degrees Celsius. 5. Place electrode in full contact with tissue. Apply moderate amount of pressure. 6. Gently press and release the foot pedal, or RF on-off button, to start radiofrequency emission and begin moving electrode. The running timer starts upon RF emission. The flashing blue light on the upper right of the display will become solid, and the device will give an audible beep every 5 seconds to indicate that the energy is on and being delivered through the active tip of the ThermiVa RF electrode. To pause RF emission, press and release the foot pedal or RF on-off button. The blue light will again begin to flash, and the return arrow will appear above the bottom left soft key. 7. Increase temperature in increments of 1 to 2 degrees Celsius per patient tolerance. Max generator temperature is 47 degrees Celsius. 8. Apply RF energy to the entire area needed for desired results. 9. Apply additional gel as needed to ensure electrode glides on tissue for patient comfort and adequate conduction. Labia majora, labia minora. 1. Apply moderate amount of warmed water-based ultrasonic gel to procedure area. 2. Select desired set temperature. Recommend starting set temperature at 37 degrees Celsius. 3. With energy off, place electrode in full contact with the skin and apply a moderate amount of pressure. 4. Gently press, then release the foot pedal or RF on-off button to start radiofrequency emission and begin moving electrode. The running timer starts upon RF emission. The flashing blue light on the upper right of the display will become solid, and the device will give an audible beep every 5 seconds to indicate energy is on and being delivered through the active tip of the ThermiVa RF electrode. To pause RF emission, press and release the foot pedal or RF on-off button. The blue light will again begin to flash, and the return arrow will appear above the bottom left soft key. 5. Apply RF energy unilaterally, dividing the left and right side. 6. Increase temperature in increments of 1 to 2 degrees Celsius per patient tolerance. Max generator temperature 47 degrees Celsius. 7. Apply additional gel as needed to ensure electrode glides on tissue for patient comfort and adequate conduction. Vaginal canal. 1. Suggested total procedure time for internal tissue is 12 to 20 minutes, excluding warm-up time. 2. Target temperature is between 45 and 47 degrees Celsius. 3. Actual temperature should be maintained within 3 degrees of set temperature. This is managed by controlled, slow movement of the electrode. Labia majora, labia minora. 1. Suggested total procedure time for external tissue is 12 to 20 minutes, excluding warm-up time. 2. Target temperature is between 42 to 47 degrees Celsius. 3. Erythema should be visualized on external tissue. 4. Actual temperature should be maintained within 3 degrees of set temperature. This is managed by controlled, slow movement of the electrode. Pearls. Request patient feedback on temperature, tolerance, and comfort. Always keep electrode moving. Keep active tip of the electrode in full contact with the tissue at all times. Avoid withdrawing electrode from contact with tissue while the energy is on. Vary depth and lines of sweeping motion, making a different path each time. Avoid contact with the cervix during application. Avoid applying RF energy near the urethral opening. Recommend 3 treatment sessions separated at 1-month intervals. Post-procedure. Cleanse the skin to remove excess ultrasonic gel. Patient may experience warmth and mild pink to redness of skin. Procedure area may experience minor swelling immediately post-procedure. Once treatment is completed, place the RF energy on pause by tapping the foot pedal or press the RF button on the generator. Clean treatment site. Review discharge instructions per office protocol. Exit patient. Post-procedure cleaning. 1. The ThermiRF Plus temperature-controlled RF system generator has no sterilization requirements. The exterior surface of the ThermiRF Plus temperature-controlled console may be wiped down with a cleansing medium as directed in the instructions for use. The unit should be disconnected from the grounded AC outlet when being cleaned. Care must be taken not to allow any liquid to pass into any electrical connections or the interior of the unit. Let the surfaces dry thoroughly. Do not use steam to sterilize the generator. Do not submerge generator for any reason. 2. Foot switch. The foot switch may be wiped down with an appropriate alcohol or equivalent medium. 3. Electrode cleaning and disposal. Dispose the ThermiVa electrode and grounding pads in accordance with the instructions for use.